Hey guys, my name is Loveline, and today me and my team are going to be going over Change Healthcare Security Breach. Okay, so on the agenda we have the background, which is essentially when the breach occurred, who or what is Change Healthcare and its role in the U.S. Healthcare system, and who was the attacker. And we also have the attacker objective, which is essentially what would the attacker trying to do, ransom domain and data theft goal. We also have the target of the attack, which is the direct target and the indirect target. So also in the agenda, we have the target method, which is essentially how attacker gain entry, what they did once inside. We have impact of the attack, so which is essentially effect on change healthcare operation, consequences for hospital, insurers, and patient. We have mitigation and responses, which is the action taken to stop or reduce the impact, communication and recovery measure, and lastly, we have our source. So on the background, in February 2024, Change Healthcare, which is a key subsidiary of the United Health Group, experienced one of the largest cyber attack in the U.S. healthcare history. Some of the major impact was disrupted billing, claim processing, and pharmacy operation nationwide. Demonstrated how single breach can ripple across the healthcare ecosystem, expose sensitive data of millions of people, reveal critical vulnerability in healthcare infrastructures, and underscore the urgent need of stronger cybersecurity practice. Okay, so what was the attacker objective? The Black Cat Group launched the breach with two main goals. The first goal was the financial extortion, which was deploying ransomware to disrupt claims, billing, and pharmacy system and to pressure Change Healthcare into paying ransom quickly. The second goal was the data theft for profit, which was essentially stealing sensitive health data such as social security number, addresses, billing information, phone number, literally everything they could get their hands on, which essentially they used as leverage for double extortion and to potentially resell those on the dark web for fraud or identity theft. Okay, so target of the attack. So like I said earlier, we have two different type of target. We have the direct target, which was the Change Healthcare itself, because they process at least 50 billion hacker transaction annually. They're like the core hub for billing, insurance claim, and pharmacy system. And on the other side, we had the indirect target, which we had hospital and clinics. They had delay insurance claim and reimbursement. We had a pharmacy. They also had prescription and prescription processing. We had an insurance company, billing, and a lot of backlogs. And we also had patient exposed of personal and medical data and identity theft risk. So the key point to remember here is while Change Healthcare was the direct target of the attack that rippled through the entire U.S. healthcare system, it also impacted other team players such as providers, payers, and millions of patients.
In May of 2024, AP News journalist Tom Murphy reported that the massive attack on Change Healthcare was due to the fact that the company had failed to implement multi factor authentication. This meant that the attackers only needed a single stolen password to get in. United Healthcare CEO also testified before the Senate, admitting that the lack of multi factor authentication gave the attackers an entry point. With MFA, even if the even if they had the compromised password, they would have needed a secondary verification step, like a token or phone code in order to get in, which would have promptly stopped the attack. After gaining access to the system, the hackers actually did a few things to ensure the organization had no choice but to pay out the ransom they were requesting. According to John Kieran in 2024, the ransomware group responsible for the Change Healthcare cyber attack was known as the ALPHV or Black Hat ransomware group. An important detail in the Change Healthcare attack is the fact that the hackers used a method known as the double extortion method. Traditionally, ransomware groups, after attacking organizations, would just encrypt files and demand money from the organizations to unlock them. But in this case, the attackers stole sensitive data information first, threatened to leak the information to the public if the ransom wasn't paid. What happens here is that the millions of patients' records, like the insurance ID, addresses, all the personal identifiable information, and just general patient records that were at risk of exposure if the ransom wasn't paid. What this does is that it puts the organization in a precarious situation where they have no choice but to pay out the ransom to the ransomware group as they do not want the release of private L Delta data. This method actually offers the attackers two forms of leverage, as is noted. The power to block corporations. It is well noted that Change Healthcare or United Healthcare were not able to process claims during the attack, as well as the threat of releasing sensitive data to the public. The attack on Change Healthcare really underscores a few key lessons to be learned about cybersecurity in healthcare. The most obvious one being the fact that multi-factor authentication really does enhance security where implemented. It's been noted on every site or every article that talks about the cyber attack on Change Healthcare. The fact that the attackers only had one entry point through the compromised credentials of an employee there, and if only they had multi factor authentication installed, this attack would have quite literally never happened. It is also important to have reliable backups. In healthcare, continuity of care is really important. When claims could not have been processed due to the attack, it will have been important for United Health Group to have had a backup system to process those claims and pay out providers to ensure that the patient had continuity of care. That way, providers are not using money from their savings. They can pay out employees, patients have no worries about if their life changing or like the life saving medications were able to be refilled to them during that period because United Healthcare should have had a backup system to process those claims. This attack also showed that prevention and preparedness is more cost effective than actually paying our ransoms. Like it would have been more cost effective for United Healthcare to have installed multi factor authentication on the employee system than to actually pay out the $22 million ransom. And all of this being said, it is quite important moving forward that we do install these processes, the backups, the steps in order to prevent an attack like this from ever happening again in healthcare.
Next, moving on to mitigation and response. The first thing Change Healthcare did was disconnect the Change systems. They made an announcement to users and then disconnected the systems to contain the breach and prevent it from spreading to other networks. And this was a total shutdown of the systems. Unfortunately, this meant that important operations like claims processing had to go offline, and it took weeks to bring everything back online as they slowly restored the systems. Next, Change Healthcare made a ransom payment. They paid $22 million in Bitcoin to Black Cat to ensure that the data gets deleted. But unfortunately, Black Cat pulled an exit scam and did not pay its affiliate. So this meant the affiliate still had a copy of the data and then took it to another ransomware group called Ransom Hub, who then asked for an additional payment from Change Healthcare. However, no additional payment was made to Ransom Hub. And lastly, Change Healthcare communicated with the affected individuals, and this included patients, providers, regulators. They sent notification letters to the affected and explained breach details, what information was exposed, and how they can go about protecting themselves. They also offered free credit monitoring and identity theft protection services for 2 years to aid in protection of identity theft, as the data exposed contained things like names, social security numbers, medical information, and much more. And it was estimated that over 192.7 million people were affected by this data breach and had data exposed. In addition to many people having their data exposed, there were also major healthcare impacts as a result of this attack. First, 55% of providers stated that they had to use their own personal funds during this time to keep their practices open because they were not able to submit claims and receive payments. Some of these providers mentioned that it almost led to their businesses having to close down. But to aid this issue, United Healthcare Group did create a financial assistance program and offered no interest loans to these providers, where $9 billion was paid out. Next, 77% of providers reported major service disruptions during this time because of the delay in filing insurance claims, prescriptions, getting prior authorizations, and receiving payments. And even after the system was back online, providers had to deal with things like billing backlog and reconnecting to the network. And unfortunately, this meant that patients also had a delay when it came to getting the care they needed, since prescriptions and prior authorizations were affected. And lastly, because of how long the outage lasted, 80% of providers lost revenue from unpaid claims or being unable to submit claims, with smaller practices being hit especially hard. Lost revenue also came from being unable to charge patients copays and co-insurances at the time of the visit, since these practices were not able to run the patient's insurance information. Some physicians are even complaining about how they were unable to file claims even 8 months after the initial attack. Change Healthcare also faced a major financial impact because of this attack, and as of late 2024, the cost of the Change Healthcare ransomware attack was estimated at $2.87 billion, as that includes things like response costs and cyber attack impacts. And it is estimated that this number will continue to rise and the cost will continue to become larger as Change Healthcare will face future expenses due to things like lawsuits. These were the sources that we used for this presentation, and we want to thank you so much for listening.